I think it might be worth educating a little bit on what to watch out for if you're a patient receiving one of these, because I think it is simultaneously true that these agents are radically less toxic than chemotherapy. Even with some of the combinations that are a bit more aggressive, I fear them as a doctor less than I fear chemotherapy. But the profile is a little bit different, and as these agents move out to docs with a little less experience with immune therapy, not every doc, I think, is going to be well attuned to early recognition and treatment of side effects. And so it may be worth arming our patients a little bit with what's worth looking out for and what should come to early attention.
Definitely.
Yeah. I think most patients have few side effects. The side effects that are commonly reported are mild fatigue, maybe a skin rash, skin itching. And then one thing that's peculiar about immune therapies is it can actually lead to alterations in the hormone balance. It can lead to hypothyroidism, where the thyroid doesn't work quite well enough. Most of these are mild and easily treatable. However, there are these rare side effects that are more severe, probably in 1 to 2% of patients, where the immune system attacks the lung, and that manifests maybe with a cough or shortness of breath, and that has to be recognized quickly. You know, you have to tell your doctor right away. There should be imaging, and it has to be treated aggressively with an immunosuppressive treatment like steroids. And that's very, very important because that's a potentially life-threatening side effect. So I think it's important to recognize most patients do very well, but rare side effects have to be recognized and treated aggressively, and actually are treatable if recognized.
So the things to watch out for are sudden changes in breathing status, diarrhea, right?
So diarrhea is the other one, although with PD-1 inhibitors, diarrhea is not that common. I think diarrhea should be reported and worked up, but it's more common with other immune therapies. There is a drug for melanoma called ipilimumab. We see that much more commonly. But with PD-1 inhibitors, I think it's important to report it. Anything that's unusual, you should report to your doctor. But really the biggest one in my mind is the breathing, the lung problems.
The other thing which can happen with some degree of frequency is liver function changes, and that usually is asymptomatic, so your doctor would just report that on the lab changes, but noticing yellowing in the eyes, noticing change in your color of urine or stool, that's an important thing, of course, to tell your doctor about as well, because those can be harbingers of very severe side effects. And as Tanguy says, these are rare. These are very, very rare, but because they're rare, sometimes we can get a little too calm about it and just say, oh, no side effects, but the side effects that exist are real. The other thing which I'd add is because hypothyroidism can happen and other endocrine changes can happen as well, fatigue is something that you should tell your doctor about.
Or a change in fatigue.
Yeah, a change, yeah, if you're already fatigued.
Unfortunately, I think all of our patients suffer from that, and we're not well armed, I think, to really fix it for the most part, but a change.
A change in fatigue, a change in how you're feeling from a temperature standpoint. And similarly, some of the other side effects of the thyroid issues are constipation. So either constipation or diarrhea, really talking with your doctor about these things, because not only could it be the thyroid, which is relatively treatable and not a major deal on a day-to-day basis, but it can also, these agents can affect the cortisol, the adrenaline pathway, which actually can be more significant for patients' lives.
So big changes in anything maybe could be our summary for our patients.
I think that's true.
And generally, much better tolerated than chemotherapy. You can
Absolutely.
extend these treatments for
That's a key point not to
times.
lose in the discussion about what to watch out for. I think in fearing hurting people, I fear hurting people much, much, much less with pembrolizumab or nivolumab than I do with the chemotherapy alternatives.
Definitely.
But it's just a different profile, so it's worth knowing about.